Hi, everybody, and thanks for tuning in to a webcast. Look how many people are joining me. I think this is the most people I've had to deal with in one webcast. So we are joined by a selection of people from Doing Our Bits. We've already had a blog showing a little bit more about the amazing work that's been spearheaded by Julie, and we're going to be speaking to her. Julie, give us a wave so we know who you are. Ha, there she is. And we've got Ryan, who's going to be speaking to us. Yay. And Petra. And we've got Catherine in the background as well, tuning in. So this is a great opportunity to highlight what these guys have been doing. It sort of really resonates with me when I spoke to them at great length about this. So I'm delighted to bring you all in to this amazing webcast, and I hope we're going to be able to give some amazing gems of information to the fitness professionals out there. So Julie, Doing Our Bit, I know you're on mute, so I'm going to encourage you to come off mute. Doing Our Bit was created to help tide people through lockdown. So I know that you started off offering fitness to frontline workers. There's about 100 people you started off with. So I wanted to know why it was important to keep this going now that lockdown is over.
So yeah, it's been quite a journey from the 100 people that we first started to try and sort of have an impact on. The pandemic may be over for now. The NHS is still really seeing the impact of that disruption over the couple of years. So although the initial pandemic is over, there's still huge signs of burnout in our staff, in our NHS and social care staff. There's so many different competing priorities, I suppose, at the moment, in terms of getting the waiting list back, the ambulance wait times. Everything is of like an equal importance, and the workforce really are sort of burnt out and tired now. So I think as well, lives just seem a little bit busier. We're always connected, we're always online digitally, and switching off is more difficult. So with the added complications of the cost of living crisis, we still need something like this is really what the NHS and social care staff need for now and sort of into the future. I think what we tried to do was, well, not initially because we didn't realise it was going to be so big, but as we've sort of moved on, we've really tried to create a legacy now for what this could do for now and in the future, and ensure that Doing Our Bit, I suppose, is future-proof, and it provides the NHS and social care staff with what they need. The main part for us is that we want a healthier and a happier workforce. And we're aware that there are a lot of health inequalities in all sorts of communities across the country. So the NHS staff are just one sort of community that we can help. So that's the plan for moving forward, really. It's like keep it going. Lockdown's over. That's what this was for initially, but we've now got a real new focus for it.
So it was born in lockdown. So what was the sort of the driving force for you to, I know a lot of us had a bit of time on our hands. I mean, I was homeschooling. So I came up with loads of ideas, but what really made this come together for you? Why did you think, I'm going to look after these 100 people? I want to know a bit more about that.
So we were running physical activity sessions, circuit classes in lunch hours and things like that just before lockdown, and they were working really well. They were showing a big impact. So we have data that shows that our absence levels went down, and it's really interesting to show that in a sedentary workforce, the difference that actually just doing an hour of exercise a week or encouraging people to make that start on their physical activity journey, how important that was. So lockdown started, everything changed, the world changed, the NHS very much changed. So I wanted to try and keep that going because we were very aware that people couldn't access the gym, they couldn't do certain things, they were stuck with long shifts if they were frontline, and a lot of our staff were deployed, so it was difficult for them to keep this up. While a lot of people were working from home and being locked in, actually a lot of our staff weren't, but they just weren't able to have that downtime. So for us, something like this was still super important. So my husband, who's a personal trainer, was doing free fitness classes from our kitchen, streaming those online for our staff. So it's always really nice to think back to the days where Doing Our Bit started in my kitchen. It became apparent quite quickly that actually lockdown was going to go on for a lot longer than we thought. So he had a second job. He worked for Jaguar Land Rover, and that wasn't sustainable. So we talk about sustainability for the future of it. That wasn't sustainable. So the idea initially was for me to become a personal trainer and to deliver the sessions myself. And then this whole conversation started with a few of the industry partners. And that's where Doing Our Bit started, really. It's like, how can we provide the NHS staff with something that will help them in the future? And suddenly that 100 staff that we wanted to help turned into 10,000 in one organisation, and now just over 750,000. So that is super exciting to think that we could reach that many people if they know about it and if we can provide them with what they want.
Congratulations on that. You know, this is dreamed up in your kitchen, right? And think of the reach. And we know how important and how much it's needed. So kudos to you guys. So what surprised you the most about maybe how Doing Our Bit has kind of grown, or tell me some of the things that have surprised you about the journey?
The speed. The speed you can make something happen if you are determined and you've got the right people backing it. So we definitely had all the right people around the table right from that start. Doing Our Bit was up and running and online in 6 weeks. So from that first initial conversation around how do I get qualified to having a platform online with around 30 workouts on it initially, 6 weeks in the middle of a pandemic. So that was amazing. That was a real surprise. I think the enthusiasm that I've come across all the way through from those involved, from the founder partners, from the trusts and the wellbeing leads. I mean, I had so many conversations with trusts that were like, where's the catch? You know, we love it. Where's the catch? It's free. When are you going to start charging me? So they've been really enthusiastic right from the start. PTs, the amazing PTs like Petra and Ryan, just wanting to do their bit. They wanted to give back. They're always on hand to do live sessions and things like that, and just the real enthusiasm as to how they can get involved and do their bit, but also what it means for them, and they've got probably very personal reasons for doing that. And then NHS staff, I think the feedback that we get is brilliant. That's why we do it. Even if we change the physical activity levels of a handful of people, that's still worth it. But when we get that feedback of people that say they've just started training for the first time, those are things that make it worthwhile. So that surprised me. I think another element probably was around that there was such a need for it, that there wasn't access for people to go out and do that at the time. And actually, when we dug down, that became really apparent. Even in trusts and organisations, they wouldn't have any space to be able to carry out any physical activity. Things were closed and days were long, I suppose. We've done really well on awards. We've got a trophy cabinet. You can see some of them up there. So we've won a number of awards. We've got the HSJ awards, which are some of the biggest ones in the sort of medical industry. We've got those in a couple of weeks where we find out, we're shortlisted, we find out whether we've won, and the press coverage. So it's big. It's bigger than we thought it would be. So the speed grew. Oops, sorry, that's just cut out a second there.
That's okay.
The speed it grew at, and the legacy that we've created without knowing that was going to happen, really.
And this is going to keep on growing and growing, right? And we are going to hear from Petra and Ryan. They're not just looking beautiful in the background. We're going to hear about why they're helping drive it forwards and stuff. So we'll get to that in a moment. But, you know, one of the things that's always been important to me in my career, and it's been over 30 years, is about standards and professionalism and stuff like that. And I think what I'd like to check in with you, and obviously we can see that growth, there's clearly a need. There has to be, if that many people are jumping on board with it and continuing to, which is amazing. One of the reasons I wanted to talk to you about is how I recognize the professionalism within this, you know, because actually, honestly, if you sort of said, oh, I'm gonna conjure something up in my kitchen, you know, and just to help out the mates, you know, in lockdown. But what I know about this is that the amount, sort of the professionalism that's gone through it and is running through it. So tell us some more about that.
So if we're going to, as NHS employers, if we're going to recommend this to any of our staff, we need it to be safe. So actually right from the beginning, it was crucial that the standards were upheld, you know, it was professional. And that has always been our priority, really. So every video is assessed by the industry assessors. Every second of every video is just double checked. Make sure if Ryan tells us to do a squat, we're doing a squat in the right way. But it is really important, because if people are exercising on their own, unsupervised, you haven't got that face-to-face contact. So we just need to make sure everything is sort of as it should be. We have a number of wellbeing leads in our organisation who are also sort of physios and things like that. So they've sort of said to us how important that is for them. Again, if they're recommending it, they may recommend one of our workouts to staff that may come through the occupational therapy route. Actually, they know that that's been assessed, then, rather than sort of sending them off into the world of YouTube and things. So that has come back from the occupational health leads as being crucial. And we want to make sure, even if it's not one of the videos, that everything on there is high quality. So the information, the resources, they're all sort of either peer reviewed or they're from the correct organisations. So I think once you start delving into the internet, it can become a bit of an unsafe place. So this is the safe place for high standards, professionalism, and everything you find on Doing Our Bit has been checked out, and it's safe for our staff to sort of take part. All the instructors, all the amazing instructors and coaches, they're all qualified, suitably qualified, and they're also, I think what's really nice is they're also representative of our workforce. So again, if you're looking at sort of professionalism and feeling that this is embedded in the NHS, we have instructors of all shapes, sizes, ages, ethnicities, and that just plays the part in really embedding this high quality, I like to say it's high quality product.
You know, the amount of kind of checking on things is really impressive to me, particularly when you've got something that's, you know, growing at that scale. You know, you could think, well, they're all qualified, they're all this, it should be safe and stuff, but the fact that you're checking through that, that's, you know, really impressive.
Yeah, so I think from the 6 weeks that we had it up and running, obviously we started with around 30 videos on there. The fact that they assessed those within that really short space of time as well, because by the time we'd sort of gone out to the PTs and asked them to do things, and then got them sent in and uploaded, you know, it's probably a space of 2 weeks maximum, and they assessed everything in that time. So they've played a massive part in this, the assessors.
That's incredible. So you know, we're looking at health, we're looking at well-being for the NHS. So how can you actually check in on how effective, what sort of impact you're making to the NHS?
It's, I mean, I've worked in the NHS for 20 years now, and measuring impact is always a really difficult thing, whether that is around patient and public involvement or the impact on a wellbeing initiative, because you have measures, but they're not necessarily the right ones. So for this, for example, you could measure the number of days lost to sickness and things, but there's always so many other complications that can affect that actually then you're talking about staff surveys and individual, probably small research projects that we're looking to carry out in the future. But at the moment, we are doing it by reach. We're looking at the impact through stories from our participants. So very much looking at the qualitative data rather than the quantitative. In terms of sort of facts and figures, when I was initially, pre-lockdown, when I was initially running the circuit classes and the outdoor circuit classes, in the first year that I started running those, we had a reduction in our sickness levels by 40% in our organisation, which is just huge. The biggest impact was in musculoskeletal and mental health, which fits with what we probably thought it would be. But you know, you can see that need, you can see the impact that is for a workforce of 180. Times that by the 1.3 million, I think, that you are looking at for the whole of the NHS, and the impact could be huge financially. It could be really big. We worked out that days lost to work were around £90,000 in year prior to the intervention. And that's, sorry, the saving was £90,000 in year one. in terms of days lost to work. So the impact is just really, really needed. And then I think when we're looking at our sort of participant stories, I suppose, the people that are the end users, that's where I think the impact is, the difference it makes to their lives, to their families, and increasing and improving their health, increasing their physical activity and improving their health for the future. I think if we're looking for stories, probably hand over to Petra, because we reached out to Petra because we had a very specific request. So I don't know, Petra, do you want to come in and share your stories of the impact and why you got involved?
Yes, happily. My specialist is cancer and exercise. So you doing our bit were approached by a member of the NHS that was going through breast cancer, and I jumped in and helped her to overcome her fatigue and all the other side effects that were going with the treatment that she was undertaking at the time. So my clients are more about getting out of bed in the morning, about moving, about being able to function day to day. And part of that, I mean, for a lot of people that are going through treatment, they still go to work. And certainly people that are working in the NHS, you know, with everything that's going on now and in the pandemic, will still want to go to work. So to be able to do some exercise, even if it's light exercise, then that will, as you've already said, makes people feel better, and it makes people feel better, you know, regardless. So yeah, it was very important for us to do that.
Yeah, amazing. I think when I was chatting initially to Julie and Catherine, when I heard the stories about you, Petra, and Ryan, what you're doing, I was like, we have to bring these guys on board, you know, just because it's just so nice to hear the people that are doing it. Again, it's that, you know, that specialism. I think that, you know, again, Julie, when you were talking about it before, some people have never done exercise before and they've started. That's amazing. But be able to offer, you know, something for somebody, you know, like you say, someone who's going through cancer and treatment, life doesn't halt, does it? So we want to be able to be keeping them, you know, on track, I suppose, a little bit. And so it's really lovely that you're doing that. Can you think, Petra, of any sort of particular thing that really, I don't know, you wanted to share with the group about, you know, your work within doing our bit?
Oh, well, it's amazing, isn't it? I mean, the whole online thing was completely new to me. I had premises before, so everything was face to face. And then, of course, lockdown hit us. We were shut down, you know, within days. And it was like, what do we do? What do we do? And I went online. So I was really new to it. It was all new to me as well. I'd never done anything like it before. I was absolutely terrified and worn out, because every single client that I work with, I was doing it with them, because none of us had done it before.
No.
You know, it was really challenging in lots of different ways. And because of, as I've got older, I've become injured, or, you know, the illnesses and things catch up with us as we get older, and my clients have become older. And as much as we all might have loved to have done boot camps and, you know, circuit training and all that kind of thing before, now, you know, it's, for some of us anyway, we have to take a little step back and think, well, because of this injury, or because of this treatment, or because of whatever it is I'm going through, I still want to do something, but I can't do what I was doing before. So for me, it was really important to retrain and get different qualifications so that I could help those people that needed it. And one of my clients actually found a lump whilst we were training. Yeah, really. Yeah.
That's significant.
He just kind of you know, just sort of did something and went, oh, what's that? And she had a horrendous couple of years, but it was her that actually made me think, I want to learn what I can do to help her continue her fitness journey. So, you know, to give back, the NHS give back to us every day. And as trainers and coaches, we're giving back as well. And if we can give back to the NHS, then And that's the, you know,
love that, Petra.
The whole
Love it,
picture, isn't it? So
yeah, amazing. Thank you so much.
That's doing our bit.
Exactly. Julie, I'll hand over to you because you might want to bring Ryan in just now.
Yeah, and I think just adding from what Petra said then as well, I think it was a difficult time for people in many industries. So everything changed, like Petra said, in lockdown. A lot of people probably had facilities before, and if you're self-employed, there probably wasn't as much like furlough or support or anything like that. So we were reaching out to these amazing people at a time where they were probably going through one of the most difficult times of their lives as well. So the generosity that came from them to give up their time to get involved in this has just shone through. So we're really proud of them all and really thankful for them all as well. But I think when we're talking about impact, I think there's an impact for those, like Petra said, that are getting involved as well. So I don't know, Ryan, if you want to come in and say about why you got involved and the impact it's had for you.
Yeah, absolutely. Yeah, I mean, obviously on some similar lines to Petra, getting involved with the NHS and the sort of giving back that we could do through the doing our bit was kind of really important because, I mean, I've worked as part of the NHS and I've got family who've been looked after by the NHS and they've done a great job for it. And, they come in day out and, day in, day out. And there's people that you meet, that they're looking after you. They're such beautiful and caring people. And often it goes underappreciated out there. And I sometimes think, like, when this opportunity came along, I'm like, well, this is fantastic. Okay, our situation might not be great at the moment, like Petra, shutting down the premise, putting it on hold for however long, nearly a year, I think. I was doing some of the live stuff, learning again, like Petra, to sort of take a sidestep and do things a little bit differently. And this opportunity, I'm like, yeah, I can't resist to being part of it, really, I want to be able to do that and help those people that are giving so much with their own health and well-being so they can feel good about themselves. And it's kind of a nice circle, isn't it, really? Because if they're better and performing better, then it's going to be better for us when we need them. So, more could we have? And every recording we did, we started with a thank you message, which I thought was an excellent sort of unique part of the platform that, we'd open up with saying, thank you, NHS, for what you've done, and, whatever else we said personally. And, and then obviously provided them with varied workouts, which is excellent, really.
Amazing. And Ryan, I've heard, like, if there's like live sessions as well, is that things that you do?
My hand
well?
goes up like that. Oh, I'm basically, I like to get involved in everything. I mean, that's just me, Somebody says, if you heard about this opportunity, what? Yeah, I'll have a go. It's fantastic. So, yeah, they've come up with a few things. One was like a men's mental health day. There was another mental health sort of conference. There was like a wellness Wednesday with one of the trusts. There was a health day, wasn't there, which was, I don't know if that was actually at Wolverhampton. One of them was anyway. As Julie's Home Trust. And they were great to be part of in slightly different ways. Some was providing like a longer workout. One was providing like a shorter workout. I mean, I know the one on the health day, that was like compressed into like small get up and shake up and what you can do in like a very little amount of time. And I know the sort of response from some of the GPs on that was that we could incorporate this with our teams, we could even save this clip and use that and get our teams moving. And, that was like, well, what a great thing to hear, because I might only have 5 or 10 minutes in that bit, but then it can continue to keep giving. And, that's something that you really want to make an impact. And, throwing it into sort of like the mental health or mental well-being things, well, it's what a great bonus, because exercise and mental well-being, they're like this, aren't they? And it should be more so. So, yeah.
Yeah. Well, you guys are making a massive impact. It's amazing. Thank you so much for your contribution. I'm going to come back to Julie. Yeah. It's so refreshing to talk to people. Like often there's a lot of talk about what we could do, but to actually make the change and to know there's been this impact and it's just growing is so exciting to hear. Now, I know that you are sort of got links now with SimSpa and UKActive, and that only, for our fitness professionals out there, they sort of go, oh, okay. So tell me more about that.
I think at the beginning, I probably didn't appreciate the impact that it could have by sort of bringing them on board. the other partners obviously did, the industry experts, and I think they sort of got across quite quickly that it was imperative that we got them involved, and supporting it. Just adds weight to the platform and what we're trying to achieve. Again, coming back to the high standards, it makes sure we sort of everything is of a high standard. I think for the PTs that are involved, they know then that the platform is sort of respected, recognised, and regulated then through the interactions with sort of CIMSPA, and it makes our stakeholders probably feel safer knowing that they are sort of backing it. UKActive, I think their mission around getting more people more active more often is exactly what we want to do every day in the workplace. Ryan mentioned there about one of the videos I think he did for GPs, and I was on the session, and I think there was about 180 people, and I went on and checked the cameras of everybody, and you could just see them doing their squats and things like that, and it was like, do you know what, this is really what we need those people. They were doing them to depth, Ryan, as well. It was all right, I checked. But we need those people just to, when you do have a sedentary job, you think about nurses walking tens of thousands of steps every day, but you have also got the rest of the NHS workforce that probably nowadays don't move very far from your seat, so it's even more important. So that mission for us was crucial for bringing UKActive in. Improving the health of the nation, they're sort of always trying to inspire people to go ahead with that sort of mission. And the NHS is just one part of that, I think. Yeah. And it showed me what partnerships can do when you work together to create something like this and bring in the right people. They can be really powerful. So I think that has just added to what we're trying to achieve. Yeah. And I think we've all got the same aims, values, mission, and it's driven us to where we are now, and hopefully sort of lobbying for a healthier NHS workforce for the future.
It's amazing. I'm loving it. I'm loving it. So tell me any particular stories that just spring to mind that you think will sort of, I don't know, add even more to this webcast about doing our bit. Anything that's maybe affected you, or you know of anybody taking part. Be good to hear those stories.
So we do get really good sort of testimonials that come through. The one story I use when I'm sort of, and it still gives me goosebumps now, is the Petra one that we've sort of covered. And that email, when that came through saying like her journey and what she wanted before her treatment, you know, her treatment couldn't do any more for her, that poor lady, and to be able to give back to her and try and help her during that really difficult time was why we do what we do every day. I think it's important that we all do this in our spare time, me included, you know, everyone that works on this. It's just a sideline. We want to give back. We've had people getting in touch with us that say, I think we mentioned earlier, around just starting fitness for the first time, never done anything since school, in 40s, and really, you know, this has inspired them to start, because the workouts do start from all levels. They start from chair-based right up to the really sort of high impact ones. And we've had somebody running their 3rd marathon in 3 months come to us and say, oh, I did a mobility session the other day. And I've got a personal friend that uses it, and she's a community health worker, and she does the sessions with her children, because there are sessions with Ryan outside. Outdoor fitness is something that we want to do a lot more of as well, so that sort of covers that. We have women, menopause is a huge issue in a number of workforce at the moment, and it's becoming more apparent. So we have a few videos on there around the menopause, and again, people are coming back to us and just saying, you know, some of the advice they're getting through this or other places that we're signposting them to has been life-changing. And when people come back to you with that sort of feedback, it makes you feel a bit warm inside.
Absolutely.
We're trying to create a little bit as well, and this has come across, a sort of group mentality in terms of group exercise. So although a lot of the sessions are meant to be, well, not meant to be, are able to be just streamed whenever you want, and you can go and do it in your own time, we are encouraging organisations to put sessions on for their staff. So it's just, you know, put a calendar invite in, invite everybody in your team to come and do Petra's session at 2 o'clock on Thursday, and then they come online before they have a little bit of a chat, and they really get that fitness community part of that, even if they're working from home. I'm a competitive powerlifter, so I compete sort of internationally, and I've done some of the boxing sessions, I've done some of the yoga sessions on there. Yoga and powerlifters don't normally go together, but it is crucial. So I don't think it matters what you do. There's something on there where you can learn new skills and keep your activity up, especially for people like me in sedentary roles. You know, I think today I've done about 800 steps. I'm going out for a run afterwards, but you just don't move. I
know.
It's really important.
And absolutely. I'm so sedentary now. It's unbelievable. So yeah, I'll be doing a workout shortly too. Ryan, you mentioned something a little bit earlier about sort of mental health and stuff. And so Julie, I was going to just come to you and get you to talk about the mental well-being hub. Is that right? That's come about. Tell us more about that. I mean, let's be honest, we know it's so needed, right? Just across the board. But I'd love to hear how that's made sort of significant impact to the NHS and why.
So it's very new, actually. It's only been online for a matter of weeks, probably. So we're initially obviously focusing on physical activity. We had some motivational videos on there, or educational videos, which probably crossed over a little bit into mental health. But we were actually approached by a paramedic who said, loved the platform, wanted to get involved a bit more. But they said, is there anything we can do in terms of increasing the mental wellbeing information on there? What they wanted to do was have somewhere safe, like we've said about the standards and the professionalism, but have somewhere safe where they could signpost their staff to. So especially following a traumatic call for the ambulance workers, they have got their own employee assistance programs, or whatever that's called in all the different organisations. But actually, a lot of the time people don't want to access something that is work. They want to stay anonymous. They want to stay sort of out of the system. So we're working with them now to try and come up with this alternative. So we've got the mental wellbeing hub. We're going to have videos from some of the guys at West Midlands Ambulance on there, so we can really show like a peer-to-peer support element of it. But it is just the very beginnings. This is an area that, as fast as the physical activity element grew, I'm hoping that the mental wellbeing and mental wellness section can grow that fast. So we're bringing on all sorts of new people. We have a new ambassador coming soon who is a doctor on Channel 4's Steph's Packed Lunch. He's their resident GP. Really proactive in terms of GP activity and increasing communities to get moving. So I think he will be probably bringing on a lot of other mental wellbeing specialists as well. So coming soon, I think. It's there. It's going to
go, isn't it? It's amazing. So I've heard in quite a few of the answers about, you were saying about group exercise, getting people together, the fact that it's peers and stuff like that. So I'm guessing there's kind of almost like a community that's being created in doing our bit.
There is, and I think the community is created through, is sort of a number of different elements of it. So we're trying to empower people to create these communities, which is one of the sort of ethos things behind it. And whether that is your content providers, we've got advocates or influencers, the fitness trainers themselves and instructors, community leaders, NHS staff, all those little communities I think we're creating. But actually what we also want to do is bring the fitness trainers together more, create a community for them to be able to share their experiences, share knowledge, and share their involvement in the platform. So when we do say to poor Ryan, you know, who can do a session on Friday, we're giving the opportunity to people to say, I really want to give back more, or I want to get involved more. I think we've all got our part to play in developing healthier communities and reducing the health inequalities. And actually coming back to something Ryan said earlier, around, you know, looking after the staff to look after the patients. There's a lot of research that has come out over the last couple of years that shows that if you look after your NHS workforce and really look after their well-being, patient outcomes are better. So we're all playing our part in that. We're playing our part in improving the health of the whole country, not just NHS staff. You know, that has a knock-on effect. So I think that's really powerful in terms of, sort of the community part.
Yeah, I'm hearing the words playing our part, right? Petra and Ryan are playing their part in it, and I know there's a lot of people sort of backing what you're doing, Julie, and it's amazing. So I'm going to come to each of you, Julie. I'm going to come to you first, and then Petra and Ryan. I just want a few words from you each about why do you think a fitness professional listening to this or watching this, why would they want to become part of this? Julie, to you first.
If it was just one message, I'd say be the reason why people move more and look after their health and look after the patients.
Boom, that's a mic drop, isn't it? That's amazing. Yes, Petra, if you're going to say the same thing, it's fine. You can just say snap.
What she just said. Yeah, absolutely. I mean, you know, all right, we all work for money, but when you do something like our work, the job satisfaction when people come to you and say, you've changed my life, you know, and they do, and that's why changing
that's
lives.
enough, isn't it? That's enough, right? And when you're
saying
Ryan's
going to go with this,
I know it's sort of like, you know, when you get those goosebumpy type things because you know you're making such a significant difference to people's lives. It's amazing. Ryan, you're next.
If nobody's still in all my words, I'm only kidding.
I know.
Yeah, obviously I agree exactly what Julie and Petra have said. That's absolutely fantastic. But I mean, if you're out there as a fitness professional, you know, why did you get in the industry in the first place if it wasn't to help people? That's what brought me there, you know, wanting to see a difference in people's lives, wanting to see them flourish, wanting to see them do better, live longer, be happier, more able. And if we can do that for our NHS team, when they're dealing with us in our time of need, when something goes wrong, well, let's just give a little bit back and, you know, do something that's good for your heart and good for your soul and, you know, make these people feel better about themselves. And then they're going to be great for us too, you know. But we're in here for a reason, aren't we? And we do this sort of job for that. Yeah, we need to make some money, but there's points where, you know, you just need to give and do the right thing. And it is the right thing. And, you know, you'll feel great about it.
I love that. Ironically, Ryan, so I've done volunteering in the NHS. So I totally understand. I did some volunteering in end of life. It was absolutely amazing and I learned so much. And that was very different from what I do now. So I get, you know, that we need to, oh my God, the feeling that you can get from volunteering is very different. Of course, I have my paid work. I love it. It's a passion. But there can also be sort of passion in something where you're not, you know, always earning the money for it and stuff. It's just what feels right and good.
You can
and
see
that's what you go. Yeah, exactly.
Exactly what it should be. You want that factor. Exactly. And we all try and do things. We all got little bits of charity things that we want to do. And sometimes we do things like, I don't know, put a flag up on our profile, or we'll be joining to the applause for the NHS, you know, when we did the clap and stuff. They're all really nice things, but you do this, you're actually giving something genuine, direct to them. And it's actually going to benefit them instantly, you know, and then in the longer term, you know, direct giving, which I quite like that. I think that's an important thing to think about. You know, you give it something that they can actually do something with.
And I think, you know, when you think of the effect, when you're saying that patient outcomes can be better, when you're thinking that, you know, home life, kids, how they're affected, you know, if somebody in the NHS is only coming to exercise and they, you know, that it ripples out to their friends, their family, you know, it's amazing. So let's not just think about we're affecting just one person at a time. It's like that, isn't it? It's amazing. So yes, of course you can.
Can I?
Petra said she was going to sing and dance, so I'm not sure is that this moment, Petra? Okay, you go for it. You go for it.
I would say to any of the PTs that are listening or watching this, you don't have to, you know, you don't have to give up your entire schedule to do this. You can do one thing, or you can do more. You know, and even if it is just one thing, then that's going to help someone. So just give a little bit of your time. And it's so, you know, it's not a complicated process. You take a video, you send it in, you know, just follow the guidelines.
There you go. And you know,
So
it's going to
just
be checked anyway, right?
Yes.
So it's going to,
Yeah.
it's not like it's just being let loose in the world. You're going to be qualified, you're all of these things, and there's going to be that professionalism to back you all up. So it's amazing.
Yeah.
Thank you.
And
Thank
just
you.
do that one little bit and just help even one person.
Perfect. Love that. Julie, I'm going to come back to you. And I feel like we're supposed to, I've got all my questions written out here, and we've gone through them all, and I feel a bit gutted that I'm going to have to bring this to an end, because it's been such a pleasure to talk to you all. I'd quite like to have planned to have done a workout as well. That would have been good. So what I'd love to do, Julie, is just give you an opportunity to highlight anything that we've not spoken about already, or some sort of final last words to the FitPro community.
I think it's just a case of join us, please join us, sign up now, play your part if you can in creating these healthier communities. As Petra said, all we're asking for is like a 20-minute video, a 5-minute video if you want to do something quite sort of niche, get your areas of expertise over. If there's something that you wish you could do more in the gym and you don't get that opportunity, then this is a platform. You know, you can do very niche areas on that. Be part of the legacy, that we're trying to create through doing our bit, and we'd love to have as many people on board as we can. We will see what we can offer in return. We'd love to hear back from people on social media, but we will build this platform based on the feedback of what NHS staff want, but also actually what the trainers can offer. So yeah, you can play your part in making it bigger and better, and let's hope that the NHS can embed this even more moving forward. I think my aim is to ensure equity of access for all NHS staff. So what we do find is that any sort of wellbeing initiatives sometimes are quite difficult for certain people to access. So it shouldn't matter where you work, where you live, what job you do, what band you're on, what salary you're paid. You should be able to have access to this. So we're trying to build that, and we can do that through word of mouth as well. So if you've got any colleagues any colleagues or friends in the NHS, tell them about it. Get on board. Wear your t-shirt with pride. We've got Ryan and Petra in their t-shirts.
Look at that.
I've worn my corporate NHS hoodie, so I haven't got mine on today. But yeah,
and I brought my blue wool. I mean, we've all done well.
So yeah, that's it really. But thank you, thank you to all the partners that have helped it. Thank you to all the amazing PTs that have got us where we are, and come and join the Doing Our Bit family.
Yeah, I love that. Thank you. So I want to say a massive thank you to all of you for joining this webcast. I think that, one of the things that I constantly am about is just making sure that our fitness professionals feel educated and supported, and we signpost them to things that we believe that they might want to be involved in. And certainly we're always going to highlight things that, we believe about professional standards and stuff. And you guys have showed up to illustrate that. And I just want to, congratulate you all for doing your bit in doing our bit, and just to wish you just amazing success going forwards. So should we all do a cheesy wave to say goodbye? Should we do that now? Goodbye, everybody, and thanks for tuning in.